So I've been dispatched to a 4-year-old girl with difficult breathing, and I'm wearing my PPE. The scene looks safe to me. On first impression, I'm seeing definitely a sick child, but the situation doesn't seem too dire that I need to call ALS just yet. But can I go take some vitals, go figure things out, see if I need to call ALS? Hi, my name is Kendall. I understand that she's having some difficulty breathing today. What's her name? All right, Anne, a beautiful name. So, why did you call our ambulance? And while you say that, I'm gonna take a pulse. Okay, so she's been sick for 2 days now, but it just drastically got worse. All right, her respiratory rate seems a little fast, so does her pulse. Do you mind if I take a full set of vitals? Okay, so I'm gonna do a pulse, her heart rate. All right, it's 124, and I'm going to do the blood pressure now. It's going to be a little bit of a tight squeeze, so it might help if you hold her. It might calm her down a little bit, make her feel a little bit more comfortable. I'm sure it might make you feel a little bit more comfortable too. All right. All right, that BP is 128/87, and then I'm going to do an SpO2, 92%. Her respiratory rate is also 32, which is about normal, but it seems to be a little bit labored. I'm going to listen to the breathing to see the quality of it, see what's really going on here. All right, so we seem to be clear bilaterally, but I'm hearing some wheezing on exhale, and that's definitely not good. She seems to be in a lot of pain. So, does she have any past medical history that would explain this? Okay, and also no medications. Okay, but she does have an inhaler. All right. Could you go grab that for me? Is that all right? Okay. I'm gonna finish up vitals over here while you grab that, and then we can give her some help. So I'm just gonna take a quick BGL. It's gonna be a little bit of a pinch, but it'll be over real soon. 1, 2, 3. All right, so that is pretty normal, 123. I'm not too worried about that. I'm just gonna do a full body exam of her, if that's all right. I'd like to, you to hold her again, if that's okay. Really quickly, I am gonna give her some blow-by oxygen as you get that inhaler, and I just want to make sure that she's as comfortable as possible, and then we'll fix her up with that inhaler. All right, so doing a full body assessment. I'm not seeing anything too alarming, but she does have some flushed skin. And shine this flashlight in her eyes. Okay, pupils are equal and reactive. That's a great sign. So what I think we need to do is give her a dose of that inhaler. She's on blow by oxygen right now, which I think is helping a little bit, but I definitely want to make sure that we give her that medication. I think that's really going to help her situation. So I'm going to do that right now. If you could assist, that would be wonderful. I'm sure she's better used with you. Okay, 1, 2, 3. All right, so now I think we're gonna just do transport. This is looking like an infection to me, but we'll take her to the hospital and see what the doctors think. So is that all right? Is there a preferred hospital that you would like? Okay, so we're gonna initiate transport. So I'm gonna have you come with her because I just want to calm her down, and I know it'll calm you down too. And I'm going to put her in semi-Fowler's position to make sure that she has the best breathing possible. And I'm going to take another set of vitals now just to make sure nothing changed, or if it did, it was for the better. So I'm going to take the SpO2 again. All right. That is 90% on room air, not, oh, sorry, that's 95% after that nebulizer. So that's definitely good. We're getting better. I'm going to take her blood pressure again. So once again, she's going to feel a little bit of discomfort. So definitely like give her some support in this. All right, and then I'm going to take her heart rate again. I'm going to take another BGL just to be safe. I know that's a lot. It's hard to watch because it's a little bit painful for her, but I'm going to make it as quick as possible. I just want to make sure everything's normal with her metabolically, all right? All right, she's doing a great job. I just want to make sure that she's breathing well. I want to listen to her respiratory rate again. It's seeming a little bit better, but there's still some wheezing and a little bit of difficulty. So I just want to make sure that she's still on this blow-by oxygen. So we're going to keep her on that. And I think that's going to help her situation much more. So I'm going to place oxygen back on her. And at this point, I'm just going to do an entirely full body assessment. I'm just going to assess everything. And she might be a little bit uncomfortable because it's a lot of hands-on interaction, but this is really important. I want to be sure that I can rule out any pertinent negatives or pertinent positives. So is that all right with you? Okay. So I'm not feeling anything remarkable on her head. Spinal column seems intact. Not seeing any bruising of any sorts. And I don't believe I asked, but is she allergic to anything? Okay, Peanuts. Gonna feel her abdomen. It feels pretty regular. I am noticing she's starting to have a bit of a belly breath, so that's just a sign that it's pretty normal in children, but it's just a sign that she's working really hard. I'm going to check her capillary refill. Little slow, not too bad, but something we want to keep an eye out for. The extremities seem unremarkable. She seems to be very healthy, beautiful little girl, so you did really great on that. All right, I'm going to give her back to you. It's been, 5 minutes. I think it's safe to take another set of vitals. I'm just going to do everything again and just see if anything has changed for the better or for worse. So I'm going to do another blood pressure. I'm sure by now she's used to it, but I'll have you keep holding her just in case. All right, and then I'm just going to take her heart rate again. I'm going to listen to her breathing, see if it's increased on this blow-by oxygen. And after that, MDI. All right, so it is clear bilaterally, and now I'm not hearing as much wheezing. I'm hearing just a little bit, but not bad at all. She seems to be really improving, and she certainly doesn't seem as labored. We're just about a few minutes away from the hospital, so I'm going to have you keep holding her, and we're going to be there really soon. She's been such a brave kid, and I really appreciate your cooperation in this. You've been a really big help. Thank you so much.